So of those, kind of the most common is going to be cervical cancer.
Yeah.
That affects about 14,000 women in the United States annually in terms of new cases. It's probably the fourth most common cancer affecting women worldwide. And in contrast to ovarian cancer, we actually have some good screening tests for it. The PAP test.
The pap smear is what that would test for it?
Exactly, and that helps us diagnose a lot of early cervical cancers or pre-cancers that we can treat and kind of get better outcomes because it's something that we can find early and treat early.
And then what about, I don't really ever hear about vaginal cancer. Would you have cervical cancer if you had vaginal cancer?
Sometimes,
or can you have just one and not the other?
There can be some association. So vaginal, vulvar, and cervical cancers, they're often associated with the HPV virus, which affects that tract. And so you don't necessarily have to have one for the other. And the vulvar and vaginal cancers are much more rare, but all of those things are evaluated by an OBGYN or your family doctor that can do a pelvic exam.